Hello everyone, my name is Shelby Torres-Unger and I'm here with my colleagues from our Psychology of Aging course, and we'll be giving a crash course into what to expect when you are a caregiver.
My name is Giselle Berber, and I'll be going over where informal caregivers can receive support and whether or not the support is effective.
Last but certainly not least, my name is Sydney Chen, and I'll be discussing some techniques caregivers can use when working with patients with physical problems.
I will be kicking off this topic and giving a rough introduction to give some background information on caregivers, who they are, and why they're needed. I will also be talking briefly about some of the challenges that caregivers have to face when dealing with family members with Alzheimer's. So the first thing that we're going to start off with is a question for the class. Who are caregivers? And when you initially heard that term, what did it mean to you?
I thought of someone who's very sweet, always wanting to help others.
I thought of assisted living, a group of professionals that you can trust to take care of your loved ones or family members.
As an opener, I'll read you an excerpt about the differences between informal versus formal caregiving. Caregivers can be formal and informal. Formal caregivers are healthcare professionals, including nurses, personal support workers, rehabilitation specialists, and physicians who, according to the legislature of society, are paid for the care and support they provide to the patients or clients. Informal caregivers are relatives, friends, or neighbors who provide unpaid practical support either on a daily basis or at least twice a week to an older adult. Before searching for information about our topic, I had very similar ideas about caregivers, but my ideas were not very vast. I had a carbon picture of who caregivers were and what they did. And when I thought of caregiving, I thought solely of an older woman who had decades of experience as a nurse, wearing scrubs, being ever so kind and gentle with the tasks of day-to-day living. My perceptions did not include the vast differences between people who have the role of caregiver. The typical care provider is a 48-year-old woman who is employed outside of the home and provides more than 20 hours per week of unpaid care. For the woman, this equates around $7,000 a year in unpaid informal support of their loved ones. The typical care providers are women, wives, daughters, and daughters-in-law. Caregiving is widely dominated by women, as you will come to notice in the bulk of our studies. Caregiving does not discriminate, however, as there are many different genres of people who have the title of caregiver. This includes parents of small children on both ends of the spectrum. In some cases, you care for your child up until they are able to perform the tasks of day living independently, or when the child turns 18 years of age. On the opposite side of the spectrum, caregivers also take care of their children with mental disorders or physical handicaps, often having to take care of their adult children for the rest of their lives. Then you have spouses, legally and ethically binded through sickness and in health. Spouses could be taking care of one another who had just underwent some sort of procedure or surgery, caregiving only for the time period of healing and rehabilitation, or your partner is just getting older and has more difficulties functioning with day-to-day tasks. We see this sort of relationship when one of the spouses is younger than the other, age gap relationships such as Sarah Paulson and Holland Taylor. We also have age gap relationships that we see popular celebrities that are less apparent, such as Nick Jonas and Priyanka Chopra. Then you move on to the adult children of elderly parents. We call these people the sandwich generation. They are middle-aged adults that are caught in between the competing demands of two generations, their parents and their children. This is arguably the toughest spot to be in. It ties directly in what we have learned in our Castell book about happiness. Our Castell book talks about 50s being one of the lowest times in your life for happiness. You have high levels of stress from your career, family life, both nuclear and extended family. And a quote from Riley and Bowen says this about middle-aged caregivers. Think about the major issues confronting a typical middle-aged couple: maintaining a good marriage, parenting responsibilities, dealing with children who are becoming adults themselves, handling job pressures, and worrying about aging parents, just to name a few. Middle-aged adults truly have a lot to deal with every day in balancing their responsibilities to their children and their aging parents. Last but not least, we have the obligated group, people with familial ties to the caregiver, a last resort as there is no one else to do the job. My dad takes care of his uncle who has dementia. His Uncle Don is a World War II vet who has extreme PTSD and advanced dementia. For a long while, he had lived in his home by himself, having his daughter who lives close by help in with checking with the day-to-day tasks such as cleaning, going to the grocery store, managing bills, etc. After a while, independent living became unattainable, and my dad was left to make all of the decisions about his uncle's day-to-day life care. Although his uncle had a daughter, she was unable to be the sole care provider because she was not equipped emotionally, financially, and didn't have the desire to alter her day-to-day life. This is a great example of the weight being transferred onto another relative of the family who doesn't have the closest ties to the caregiver, but is still related by blood. So now that we have a picture of who caregivers are, we can start to discuss the aspects that make caregiving especially important and difficult for the caregivers who are relied upon so heavily. The first part that I'm going to discuss with you guys today is loneliness. But now a question to frame our next topic. When you think about caregiving, what comes to mind in terms of aspects that might be more difficult for the caregiver? Loneliness is explained in two different ways here. First, the loneliness that you get after you lose a spouse, the grief and longing of somebody who has passed on. Relationships around you change in lieu of the deceased partner, and it is now your responsibility to find out who you are without that partner. The best representation is expressed here from Guido, 2010. The impact of widowhood goes well beyond the ending of a long-term partnership. Loneliness is a major problem. Widowed people may be left alone by family or friends who do not know how to deal with the bereaved person. As a result, widows and widowers may lose not only a partner, but also those family and friends who feel uncomfortable with including a single person rather than a couple in social functions. Another chapter after entering widowhood might be repartnering. Although they've lost their first partner, some older adults still don't want to die alone. Repartnering is difficult because of family objections, objective limitations like poor health or mobility, absence of incentives like having children or making a family, and finally, social pressures to protect one estate, the money and trust created together in the first marriage. Loneliness for the sandwich generation looks at the objective of not feeling understood by anyone at this specific time in their life. Both sides of your family, both parents and children, are looking to them as the primary caregiver, relying on them solely for support. This loneliness can have really adverse effects on their mental health to a point where it's extended throughout the rest of their lifetime. Then finally, you move down to finances of money. Of course, we all want the best for our parents, and we will try to get the best services as possible, but the financial hit might be more than we are able to sustain at a certain time. Many middle-aged care providers, the sandwich generation, as we mentioned earlier, are hard-pressed financially. They may be still paying for childcare or tuition expenses, trying to save for their own retirement, and maybe even working more than one job to achieve it. Then we circle back to the widowed individuals and the impact on single versus married couples. Single mothers are hit the hardest, mainly because women are typically paid less than men. For many people, widowhood results in difficult financial circumstances, particularly regarding medical expenses. This can be outstanding debts from care facilities that we will touch on later. Widowed individuals often suffer more financially because the survivor's benefits are usually only half of their husband's pensions. Communication is also a huge issue. Parents deal with a sense of extreme embarrassment and resentment for their children who are caregiving for them because they are losing a lot of independence and feel to come like a burden. There needs to be a good line of communication between caregiver and caregivee. A clear line of communication helps the caregiver accurately assess the needs of the loved one. This information is necessary to decide the type of care options necessary for the individual. May that be home modification, which would include things like minor structural changes, such as installing handrails in bathrooms, widening doorways, lowering countertops, and constructing wheelchair ramps. Or if the caregivee needs a higher level of attention, then the caregiver will have to start making choices about their caregiving, which includes types of adult facilities dependent on needs. Adult daycare has 3 different types of facilities. The first would be only social activities, meals, and recreations, minimal health service. The second would be intensive health and therapy intervention and social services for people with more serious medical problems who require intensive nursing care for specific medical conditions. And then the third would be specialized care for particular populations, such as people with dementia or developmental disabilities. Caregivers can come out with mental health issues and long-term effects due to this stress. The exchange theory suggests that it is physiologically uncomfortable to be the dependent party in an exchange relationship. Adult children have a hard time coping with the decline of their parents' functioning, especially involving cognitive abilities and problematic behavior with work, overload, burnout, and the loss of a previous relationship with the parent. It's extremely difficult to have a relationship change with your parents, passing off caregiving expectations from the parent to the child. The caregiver's burden is defined as a physical, psychological, emotional, and social and financial problems that can be experienced by the individual providing care for an ill or disabled person. Now, there is a difference between reciprocity and filial obligation. Family dynamics change between cultures. In Asian cultures, they follow underneath a filial obligation, a sense of responsibility to care for their parents or loved ones if necessary. Asian American adolescents report a high feelings of obligation to their families compared to European American adolescents. You can run into conflict with your partner if you come from different cultures. Raising multi-ethnic children presents challenges not experienced by parents or by parents of the same race children. Families that don't have the same values and parents can come from different backgrounds, not have the same ideals for how to deal with family members in their time of need. May that be personally taking care of their responsibility, moving family members into their homes, or finding outside care facilities such as group homes and adult daycare facilities.
So before diving into different studies, I have a question for you. Can you think of a time when you had to take care of someone for a long period of time, say like a week, a month, or more? How did you feel? Now we can look at a really interesting study here by Bachman in 2020, looking into conversation topics that caregivers talked about when taking care of people or family diagnosed with Alzheimer's disease through their posts on social media, Facebook. It definitely reflects on some points that Shelby was talking about. So what was done in the study was the conversation topics were categorized into different conversation topics. For example, basic activities of daily living, which can be found in the graph as basic ADL, instrumental activities of daily living, extended activities of daily living, and caregivers' daily issues as caregiver DI. So looking into the graph, we can see that exhaustion, the feeling of giving up, with the black triangle on the right side of the graph is a topic that caregivers discuss a lot. This totally ties into what Shelby was saying. It looks like it's one of the topics that they talk about more. So looking at the graph, it seems that the topic is something that they're dealing with. So something else that Shelby mentioned is communication between caregiver and caregivee. So communication can be seen on the graph as interpersonal communication. That way that Bachman describes interpersonal communication is a bit different than the way Shelby described it, but there are some similarities. So it falls under basic activities of daily living and is defined as a conversation that revolves around what must be done in the future, and conversation that doesn't include like talking for fun. So like they wouldn't talk about like what they did the day before or the movie they watched. They would mostly be talking about like appointments or medications. And the point can be seen as the red square between 7 and 8 under frequency of communication. So they talk about it pretty frequently. Shelby also talked about having to pick the most appropriate place for caregiving. May that be in your own personal home, or if you're forced to look into other alternatives, such as a range of facilities that cater to your loved one's personal needs. We can see that selection of health facilities is talked about in the study. On the graph, you can see it's between 5 and 6 on the frequency of communication. So to recap, we just talked about what issues there can be with caregiving. They may need help, but what kind of help? Which leads me to my next question. What type of help would you need if you were caregiving? Let's look at a meta-analysis by Lee and colleagues that was done in 2019. So they looked at 29 different studies and they found out some interesting things. So they looked at caregivers to people that had been diagnosed with dementia. They found that caregivers wanted more information about dementia when their family members were diagnosed. About half of the studies mentioned this. Also, in 11 studies, caregivers wanted support, such as emotional, from professionals. Other results from an analysis found that caregivers had negative feelings either in the beginning, when they first found out that their family member was diagnosed with dementia, or after diagnosis. Also, caregivers were more aware of their relationship with the caregiver and the change of responsibilities when they were first made aware of the diagnosis. There were some mixed results about whether or not caregivers wanted help in planning for the future for their loved ones. Those were some of the findings that I found out that stood out to me the most. So now that we know what kind of help they may be looking for, is there help available? And yes, there is. For example, there's some links on the Alzheimer's Association about different resources. There's some support groups that are being done virtually because of COVID that can be found on the Alzheimer's Association webpage. You can even find a 24/7-hour helpline on Alzheimer's Association webpage. The National Institute of Aging also has awesome resources. For example, they have a link to iCare, which is a program to help train informal caregivers. Even the Center of Disease Control and Prevention is attempting to enact policies to help caregivers. On their website, you can find an outline for like the importance of caregivers and like the plans to change policies or to support caregivers of people diagnosed with Alzheimer's. Policies they want to enact are things like more information being available and make the information of like which interventions are most helpful and effective easily available. They call it the state and local public health partnerships to address dementia, the 2018 to 2023 roadmap. So in short, there are resources available for caregivers, but are they effective? A meta-analysis done by Chang and colleagues in 2020 looks into this question. They looked into 140 articles and categorized the programs into different groups, which were psychoeducation therapy, mindfulness-based therapy, groups that offer support, planning, training, and like multiple programs, and like other. Some of their results were that they found evidence that supported the idea that all the programs have positive effects right after the program, and sometime after. Some of the programs had ranged from like large effect to like small effect. The other programs, excluding the social support, had effects, but didn't touch nearly like as many aspects in the person's life. Examples of like different aspects are like social support and depression. The social group, they looked into like 5 studies, and they found that there were no significant effects, even though caregivers continue to attend. They did mention that maybe having to like modify the way that social support groups are organized so that they do have some effect. This can tie into another study done by Roth and colleagues done in 2005. In this study, they pointed out that previous studies have found that programs are more effective when it's done to one-on-one rather than in a group. And they did 2 interventions, a psychosocial and therapy intervention, and then a program where like information usually given at New York University Alzheimer's Research. Psychosocial and therapy included 6 sessions overall with 2 individual and 4th family, a weekly support group, and being able to talk with people on the phone however much they wanted, while the other group just included receiving information, the phone calls if they wanted to. Overall, it seems that the social support satisfaction was improved, and so was the fact that they give more social support in like the therapy program. So overall, it does seem that interventions and programs can be helpful.
Okay, and to conclude our presentation, let's talk about techniques caregivers can use when working with patients with physical problems and techniques for patients with Alzheimer's. And to start off, here's a question to think about. What are some techniques caregivers can use when working with patients with disabilities? When working with patients with physical disabilities such as physical limitations, hearing impairment, and/or vision impairment, it is important to avoid making assumptions about what assistance the patient needs. We should all presume that patients with disabilities are capable of handling their own medical care unless asked to be helped, and to respect their wishes. I'm sure everyone knows in order to ensure a long-lasting life is how we choose to take care of ourselves. Participating in activities such as being physically active, going for regular checkups, and being mindful of what you put inside your body. Of course, as nature takes its course, our physical limitations appear with age or due to certain circumstances. According to this research study on reducing frailty in older adults with mobility problems, they found that in 6 months within their group of older adults, all ages above 70 with mobility problems, such as difficulty getting up, walking, stair climbing, etc., 130 of patients reported with a minimum of 17 minutes of moderate intensity exercise with the assist of equipment walkers or caregivers, boosted their confidence level by 95%, and their level of frailty decreased, concluding that older adults with mobility problems are capable of performing physical activity in their own environment with the reassurance that is done safely in a patient-centered approach. And that's the secret to caring for patients with physical problems, to approach them with empathetic and being patient-centered. Patients with vision impairments, you should always verbally identify yourself when introducing yourself and others in the room with them. Always keep in mind to verbally explain everything that is happening around and to the patient, keeping them involved as much as possible without feeling left out. Being prepared to provide written materials in auditory, tactile, or even electronic format of the patient's preference. Now, patients with hearing impairments, always ask what's the best way to communicate with them, whether that's sign language or preparing some form of written materials. To look directly at the patient when speaking with them, so it's easier for them to see your mouth. Patients with mobility impairments, to keep in mind to always respecting their personal space and making sure their path is clear and accessible. Providing any accessible accommodations such as wheelchairs, walkers, and tools to help make it easier for them to get by. Now, lastly, what techniques could caregivers use with patients that had Alzheimer's? For short term, the simplest thing they can do is set up reminders. Reminders for appointments, keeping track of medications, and even managing their expenses. Long-term wise, caregivers can provide in-home assistance, such as live-in help or hired help, such as housekeeping or a personal assistant to run errands. It varies between patients based on their own budget and expenses they or their respective family wishes.
In conclusion, this podcast was aimed to give you insight into who caregivers are and what they are needed for. Caregivers are of every shape and size and deal with incredible stress and privilege when dealing with their loved ones. Caregivers can experience loneliness, stress, burnout, fatigue, financial obligation, and caregiver's burden.
There are interventions or programs aimed to help caregivers. The interventions seem to be helpful, but there may still need to be more research on the matter.
And the techniques caregivers could use is simply being mindful of patients with disabilities, whether that's hearing impairment, mobility, or even vision. It's just to always be very patient-centered and to respect whatever the patient wishes are. So our questions that we decide to put together for you all are, what are aspects that might make caregiving difficult or stressful, and what techniques do caregivers use with patients that have Alzheimer's?